Hi, today we'll be going over the PPE and the armamentarium. For the PPE, we have our protective eyewear, our mask, and our gloves. For protractors, this is our tongue depressor and the Minnesota. We have our topical anesthesia right here. We also have our cotton pellets and our needles, both 27 and 30 gauge. Here's our syringe and our cartwheel.
Today we'll be doing extractions on teeth number 3 and 20. Before we do so, we'll be talking to the patient and taking a patient's full medical history. Hello Dan, how are you today?
I'm doing well.
Why are you here today?
I have some pain on my upper right and lower left area.
Oh, okay. Do you have any other issues other than pain?
No, I don't.
Are you on any blood thinners?
I'm not.
Do you have any problems with local anesthesia?
I don't think so.
Are you allergic to anything?
I have no allergies.
After reviewing the patient's medical history and looking at the radiographs, we've determined that the teeth cannot be saved and we need to extract them. Can you sign these forms for your extractions, Dan?
Yes, Doc.
Now we will begin the extractions.
I will now demonstrate how to assemble the syringe. We're going to take the syringe and pull back on the thumb ring. Take your carpule, place it in, release the thumb ring, and then select your gauge depending on what infiltration you're trying to do, either a short 27 or a long 27. I'm going to take the short, stick the short end of the needle into the top of the syringe, twist until tight. Finally, you're going to press against the thumb ring in order to engage the harpoon into the carpule. I am now ready to facilitate anesthesia to the patient. I will now demonstrate how to properly anesthetize a patient. I'll start off by taking the slolicane, which is 20% benzocaine, and administering on the mucosa of my patient. I'll then take my assembled syringe, ask the patient to open up, and I'm going to feel for the carotid notch. I'm then going to insert the needle lateral to the pterygomandibular raphe and position the needle contralateral to the first premolar. Once I do that, I'm going to insert the needle and feel for the bone. Then I can aspirate and feel and check out to see if there's any blood in the needle. If there is, I know I need to reposition. Once aspiration is clear, I can facilitate the anesthesia, withdraw my needle, and then wait for the patient to become anesthetized. After performing an inferior alveolar nerve block, I will now demonstrate how to administer a long buccal nerve infiltration. We will take our assembled syringe. I'm going to ask the patient to open up again. I'm going to retract the cheek. I'm going to position my needle 45 degrees to the mucosal membrane of the affected tooth. I'm going to administer the anesthesia, withdraw the needle, and wait for the patient to become anesthetized. Finally, I will be demonstrating how to perform a maxillary infiltration. For this process, we will be using a short 30 gauge needle instead of the long gauge. I'm going to take my assembled syringe. Open up, please. I will retract the cheek and position the needle 45 degrees to the root of the tooth. I will inject and administer the anesthesia. Withdraw the needle and wait for the patient to become anesthetized.
Now I'm going to show how to disassemble the syringe. So with the syringe, we will be using the one-hand scoop technique to insert the needle into the cap. Once that is done, we will disengage the harpoon to release the tension, pull out the carpule and the needle, and place in the sharps container. Once that is done, we will grab the syringe, put it in a red bag, bring it to the counter to be placed in the dirty section.
Now we need to make sure that the patient is feeling okay. Are you okay?
I'm good.
Okay, good to hear. In the event that the patient isn't feeling okay, we seat the chair back and we go calling to help. After that, we check the patient's blood pressure and pulse rate to make sure everything is stabilized.
You go.
Today we'll be performing an extraction on. Damn it. Do you have any certain issues in your medical history?
No. Wait, is it 45-degree angle? After completing the inferior alveolar nerve block, I will now demonstrate the max. What? Just look at it.
Now I need to make sure the patient is feeling okay. You okay there? Now we need to make sure and pulse rate to make sure everything is stabilized.